Good day, friends of Buzzy. So today you get me in my office, so I don't have a mask on, but I would like to say, I was gonna find a Darth Vader one to say, may the 4th be with you. But I think that actually when I get off the air, I'm gonna make myself a new mask with something springy and pretty. So I'll have a mask like that. Today on our COVID and pain management 3 times a week Buzzy Helps podcast, I'm going to talk about the updates and the interesting news in coronavirus over the weekend. I am then going to talk a little bit about some exciting things that are good that have changed because of the coronavirus. And then we are going to check in with Dr. Keith Cronin about how the new changes in the physical therapy reimbursement will change what you can do at home to take care of pain. Particularly, this episode will be knee pain. And finally, we'll talk a little bit about focus and how that can help. So, as always, if you have any questions about coronavirus, if there are any peculiarities or things you've been wondering about, please go ahead and put them in the Facebook Live. So the first thing we're going to talk about is an interesting study from Taiwan where they actually looked at 100 people and they followed 1,200 contacts of these 100 specific people to see who else got coronavirus. So the interesting thing was that 0.7% of the contacts of these people who were not family got infected, and a small percentage got infected while, actually that's not true, but 30% got infected while the patients were still asymptomatic, which is a little bit lower than the 44% we've seen in other studies. But the most overwhelmingly fascinating part of this was that the family members, whether they lived with them or not, that was the highest predictor of whether they also got coronavirus. So this tells us a couple things. First of all, it tells us why people that are in very small housing, tight housing, apartment complexes, group homes, nursing homes, why they're more likely to get infected. It's because it's prolonged exposure to someone who's positive that makes you much more likely to get infected than just casual infection on the street. So now we have a really strong piece of evidence to quantify that. The second thing it says is that almost all of the infection with coronavirus is probably indoors. That while you still could be spraying your glitter bomb of coronavirus as you're, jogging and spreading it around, probably most of the significant infection is coming inside the house or when people are in close contact with each other. So the other study that I read that I thought was going to change how we think about things is a really dense and deep study looking at the immune response. So one of the biggest things that people have found is that it's not the normal immune response that makes you sick, and it's not the virus, it seems, that makes you sick. While the virus, I do believe, is breaking up the surfactant, which gives you the oxygen transmission in the lungs. Definitely a lot of what is causing severe mortality and morbidity, morbidity is a fancy word for super sick. It's the people's cytokine storm. It's your immune system just going nuts. And so these authors hypothesized that the reason that children aren't getting as sick is because their immune system works well, and that what they found in ferret models, in human autopsies, and in petri dish tests was that the immune system with SARS-CoV-2 is dramatically weird. It's like unregulated. It's not behaving like normal immune systems do. So I think this is important because, first of all, it means that some of the arthritis drugs, some of the immunomodulatory drugs that are used right now for people with rheumatoid arthritis or for Crohn's disease, those actually may be really good drugs for decreasing or preventing this cytokine storm that causes problems. The other thing about this is that it implies that your previous health is part of what messes up your immune system. And so it also means that having a really well-regulated immune system with things like zinc or vitamin D or some of the other melatonin, for example, things that we've talked about for improving your immune system may actually be more relevant than for other diseases. So I thought that was interesting. All right, so the other piece of news for your home pain management is that the Centers for Medicaid and Medicare approved using telehealth and billing for it by physical therapists. And so what that means is physical therapists are actually very used to helping people with their PT with different modalities, whether it be ultrasound or TENS units or ICE or other things. And so if you're doing telehealth physical therapy, then if you don't have those things, sometimes you may have more difficulty. So we are going to have our dear friend, Dr. Keith Cronin, on. And so what he's going to show you is the concept for knee pain. So he's going to use one of our VibraCool Flexes, except for he doesn't have a VibraCool Flex, but the Flex comes with a TheraBand. So the TheraBand that he uses in his demo, if you've got a Flex, you can use this. Second thing is the concept he's going, that with the Flex, what you can do is you can take the Flex and attach it, like I have here, attach it to a knee unit so that you can go all the way around and put one unit on either side of the knee. He's going to show you with 2 knee units because he is in quarantine. So without further ado, Dr. Cronin, thank you for coming to join us. Nope, now I've got your sound.
All right, so.
All right, now you're good. Yeah, now I got your sound on. You're good.
Fantastic. So as you can see, I'm here at home doing everything just like everyone else. And anyone who has patients, they're going to be doing the same thing. Just they talked about telehealth is going to be around for physical therapy now and for a while, so we better get used to this. So with getting used to it, we need to make sure patients are prepared at home because they come into the office and we got all the tools that we can work with them. But now they don't. So I'm going to show you today one very simple thing, a couple things that you can actually do that are very common for anyone with knee pain, knee arthritis, post-ACL surgery, total knee replacement, those types of things. Particularly people are at home and not moving around a lot, they get stiff joints. And so because of that stiffness in the joints, we want to make sure that they're moving on a regular basis. So to do that, we can just do something as simple as a heel slide. Now, using the VibraCool, we can stick one on each side. And so this is what Dr. Baxter was talking about as far as an example. I like to put one on each side because that gets me the most high-frequency vibration through the joint. And by doing this, and I flip these things on, if you were starting the day really, really stiff, well, now all of a sudden, when you go and do you can let that run for about a minute or two to first oscillate the joint and actually get a little bit of the tissue moving before you get doing your heel slides. Something very common that you do on a day-to-day basis for any of these sort of arthritic, painful knee conditions. And as you can tell, I can move this all the way up, so the product doesn't limit me, which is great. So you have this wonderful mechanical means of being able to increase the range of motion in your knee. And then as soon as you're done with that, what do you do next? Well, inevitably, you're probably going to do your strengthening exercises. So you can take those same 2, and if anyone who's had tremendous knee pain or arthritis over the years, you know that quad muscle tends to shut down a bit. So what you can do is you can just move this up a little, and you can use this to help with the exercises as well. Just like this. And now all of a sudden, you have a means of doing your leg exercises with that VibraCool vibrating right on top of the quad. And you can go right into doing squats, or you can go into doing all the types of exercises. The whole point is an entirely portable system for something that someone needs to do on a daily basis to have good movement health.
It is all about mobility.
It absolutely is. We have to keep moving. And so looking at something like this allows you as a clinician to be able to communicate this to patients at home. Now you have something you can use on a day-to-day basis. And the goal is is reduce the pain, improve the motion, and inevitably the rest takes care of itself. So this is something that is easy to use, can be done right now, and doesn't take up a lot of space. And look, look how quickly I did this. I'm quarantined. I just have stuff in my house. It's able to work.
So Keith, I love your pink TheraBand makeshift thing. Very nice.
Right there.
So the question is, for me, first of all, how much of the strength for the knee, for the slides is coming from your arms, and how much is coming from your knee?
So inevitably when I'm pulling, it's mostly coming from my arms. I want to make this as relaxed as possible, because the goal with that is to get range of motion within the joint. So we want that motion before movement.
Okay, so motion before movement. And then how many reps would you do of each of those things?
Inevitably, I would recommend that someone do at least 20 to 30 heel slides until they get the max range of motion that they can get. And then you want to pull it a few more degrees so you can get, each time you move it a little bit more. Now, you get to the point where your heel's all the way to your butt. There isn't anywhere more to go. But if you're stuck down in here, you need to start creeping that up a little bit at a time. And this really helps because it'll knock down some of the pain. Because inevitably, the pain is what stops your arms from pulling. So if you have something that can manage this, those arms will work a little bit better.
Cool. Thank you so much.
Thank you.
See you next time.
Bye.
That's pretty cool. All right. I think next time I'm going to see if he can tell me how to deal with shoulders that get stiff. Well, so we've dealt now with some pain, motion before mobility, and then mobility to decrease pain. And for focus, we are going to share a lovely link to the students at Juilliard, and the Juilliard students are doing a version of Bolero. And stay with it because it's not only funny, but it also is really heartwarming at the end. So I really enjoy that, and that'll be a fun thing to show you. All right, so our final bit for today, let's talk a little bit about fear. So there are lots of places that are opening up, and it's become almost a political debate of, are you someone who wears a mask and stays home, or are you going out? There are 5 states who have declining numbers of coronavirus cases. There are almost all the rest of them that are flat, and there are about 11 that are increasing. So the numbers of those increasing states and the flat states are going to be the ones to watch. The flat states that have opened up, again, you're going to have to wait about 14 days. So for my office, we are looking at May 12th, May 13th to make the decision on risk for coming back in. I think that one of the things, in addition to flattening the curve, is that this has been such a good time to learn more about the virus. So we know that it's disrupted immune systems that happen when you're old. We know that it enters through the nose. We know, and we'll know soon, if nasal irrigation decreases the nasal load. There are other places doing that. I am currently looking for, and have achieved some funding to test and see whether or not nasal irrigation decreases the likelihood of going to the emergency room or getting on oxygen or going to the ICU. So these studies, many of them we will have answers within the next 2 months, if not before. We also know that their remdesivir, the Gilead drug, that actually does help for people with severe disease. We have suspicions that there are different immunomodulatory drugs that can help, so we've got some options there. And all of this comes together with the knowledge that the transmission is largely, just like any horror movie you've ever seen, it's coming from inside the house. So if almost all of the transmission is coming from inside the house, this gives us more comfort that people who are not at risk, older, obese, hypertensive, have diabetes, that they can go more comfortably out in crowds. So I really think that the landscape of our behavior is going to change a lot in the next 2 weeks, and that the positive rates that we were seeing, so long as they do not escalate dramatically, I think that we're going to have time between now and the fall to get our ducks in a row for actual testing. We're going to be able to determine whether or not kids can go back to school. We're going to be able to outfit the planes with ultraviolet C light that will be able to blinky thing them so that people can travel in safety. So I think all of those things together, we will know an enormous amount. Now, one person asked about whether or not pools are likely to open and whether or not there's a likelihood of that. And I am gonna defer answering for at least another week, because I think right now the anticipation is that because they're respiratory droplets, and because most of the time the people using the pool are younger kids, that we're still looking at exactly the same kind of risk dynamic that we have for older people. That it's not really about where you are, it's about who you are and what your underlying healthcare conditions are. So the density that we're seeing in pools is probably not as big a deal, because most of the studies looking at the aerosolized version of the virus find that the circulating air, if it's an open air pool, that should be fine. So, you know, I still want to hold off for a week or two for some of the stuff that we're finding out, but my gut is that it will be safe to have kids at the pool so long as the people who are need to be protected aren't there. Whether or not communities are going to go for that, I don't know. But my gut is that probably it's safe, and I would probably let my kids go after we wait for these 2 weeks and see what happens in this humidity, in this climate, with people circulating again, and we see what goes with the rate of the infection. I think we know enough now to be pretty sure that it's an outdoor thing. So I would probably not go into the bathrooms or changing rooms. I'd probably put a 6-foot limit or a one person at a time. I'd still be a little bit hesitant about having multiple people or anybody with any illness in the changing room, but out in the open with a pool, that's probably going to be safe if the people who are going are safe. There you go. All right, well, next time we should have a new pain care partner. We've actually had a lot of people buying these over the weekend. So we've got our What Works for Pain, 50 evidence-based mechanisms. We've got Feel Good Labs or Neptune Ice, but some sort of a pain reliever. And we've also got, I think we've still got a few left of the disinfectants. So thank you all for joining in. And if you've got any questions about anything that I feel like I know something about, please go ahead and put them in and I will answer. Thank you so much for tuning in. And you know what? It's going to be fine. May the 4th be with you.